Good afternoon, everyone, and thanks for joining us this afternoon for our Adapting Diabetes Education Services for a post-pandemic era session. This session is part of our spring online school, and we're so pleased you could join us today. Just a few bits of housekeeping before we get going. We've got the chat function available if you want to talk to the team, any sound problems or any issues like that. We've also got the Q&A there, so if you've got to pose any questions to our speaker this afternoon, pop them in there and we'll make sure they're answered at the end of the session. We're all working in various locations, so bear with us if there's any interruptions or any comedy talking on mute or any technical problems. That's enough from me. I'm going to hand over this afternoon to Dr. Neera Agarwal, who's going to take our session. Thanks, Neera.
Thanks, Claire. So welcome to everybody. If you bear with me just a moment, I'm going to share my screen and then we'll kick off from there. If anybody's unable to hear me, please do pop a message in the chat function and I'll see if I can adjust the sound settings. So bear with me just a moment. Okay, great. So welcome to everybody to Cardiff University. In an ideal situation, I'm sure we'd all much rather be sat outside here on the grass, you know, in the sunshine and having a meeting like this. But unfortunately, at the moment in the new sort of post-pandemic era, this is where we are in the virtual setting. What I'm going to do is just give us all a brief overview of, just to give a bit of context to what we're going to be discussing, you know, diabetes, obviously, and diabetes education. Give you a little bit of information, just as an opportunity for us to be able to reflect upon and think about the impact that COVID has had upon diabetes, where we were pre-pandemic and where we are sort of going now in terms of our diabetes services, and then what opportunities we have here in Cardiff University to help healthcare professionals working in the field of diabetes to deliver those services for our patients. So I've got a brief presentation here, which won't take too long, and I've kept it brief deliberately to allow opportunity for you to ask any questions you may have, preferably related to diabetes and education, at the end of this. So just to give us a bit of context, I'm sure all of you are here because you are interested in working and supporting people living with diabetes. And if we look at the statistics pre-pandemics at the end of 2019, based on the International Diabetes Federation, then it was estimated that there are over 450 million people living worldwide with diabetes. So that translates to approximately 1 in 11 adults throughout the world. And 10% of the global health expenditure is spent on diabetes, whether that's to do with diabetes therapies or diabetes complications, inpatient care. So 10%, so a significant proportion of healthcare resources spent on this one condition, and affects people in all walks of life. So throughout young childhood all the way to end of life. So a huge population of individuals with diabetes, and the frightening statistics are that it's also estimated that approximately 1 in 2 adults with diabetes are actually still undiagnosed. And it is also estimated that there is a significant proportion of people, probably 1 in 13, who have an impaired glucose tolerance as well, so are in that pre-diabetes stage. So we're talking really pandemic proportions with just diabetes. And this affects the entire world. So everybody, whether they're in the UK, in Europe, in the Western nations, in the Asians, every single continent, if we look at statistics that have been happening throughout the recent decades and projected statistics, this burden unfortunately is only increasing. And then of course we had COVID in 2020. And I don't need to rehash what's been happening. All of us are very, very familiar with the impact COVID has had on our personal and our professional lives. But it's really brought to light diabetes as well. We've heard lots and lots in the recent months and over the past year about those underlying health conditions and vulnerable population and those at risk of complications with COVID. And diabetes is up there on the top of that list. So if we look at some examples from around the world, over 50% of hospital admissions with COVID-19 in France had type 2 diabetes. A third of those individuals who died in New York City for causes associated with COVID-19 infection had type 2 diabetes. Even here in the UK, 1 in 3 of the UK deaths associated with COVID-19 had diabetes or hyperglycemia. So a significant proportion, and a lot of those of us who work in the field of diabetes can actually view this as a collision of 2 pandemics, both COVID-19 and diabetes, just looking at the phenomenal numbers that we have all been dealing with. And the impact goes beyond just numbers. Obviously, a third of individuals with death associated with COVID-19 have had disorders of glucose metabolism. There's been a much increased risk of symptomatic disease requiring hospitalization, increased mortality associated with poorer control and presence of complications, again, reinforcing that need of addressing glycemic control and improving complications with the correct skill set. COVID-19 has also had a lot of unusual pathophysiology associated with it. And what we have seen with this systemic inflammatory response that occurs with it, is it actually triggers new onset diabetes as well. So we've all probably seen many, many more numbers of new referrals, new presentations of individuals with disorders of glucose metabolism. COVID-19 has required treatment with corticosteroids. And then it's all the mental health impact of COVID-19 as well on everybody, but especially people with diabetes. That stress and fear of exposure by this constant media reminder of being in an at-risk group of COVID-19. And then the impact of the lockdown lifestyles as well on physical and mental health, where people perhaps have not sought that routine medical care that they have needed for their diabetes, or have delayed asking, or simply that facility that they would normally have access to just hasn't been available. Currently, it's a lot about vaccine, especially here in the UK, but around the world. So people with diabetes have clearly been prioritised, and appropriately so. But there's also a lot of variability of vaccine uptake, particularly in people of certain ethnic groups as well. And these groups are often more susceptible to diabetes as well. So again, another factor contributing to this. So lots of different things have further contributed to the burden of diabetes that we're seeing. And then, of course, all of us, as we're now looking at emerging from the pandemic and trying to recover our services, there have been the challenges associated with staffing, redeployment to acute medicine, staff illnesses, the absences from isolation or for childcare or caring for others. And then the challenges of physical space. So no longer can we have waiting rooms filled with individuals waiting to be seen. Our clinic numbers are significantly reduced for face-to-face meetings. We've had to be more virtual. We've had to reorganise services in keeping with social distancing regulations. there's a backlog of thousands of new cases and old cases as well, awaiting just routine care. So we clearly need methods of identifying high-risk patients and the attention that these special subgroups need. For example, people needing care for prenatal counselling for pregnancy, those at the extremes of age, individuals undergoing surgery or trying to improve diabetes control for surgery, those with established complications or at-risk individuals trying to prevent those complications. A lot more people using diabetes technology and the support that that needs, and supporting education for self-management. So all of these factors are still there, but have to be delivered in a new way. And over this past year, all of us, myself especially, have acquired new skills of managing our workplace and delivering clinical care in a virtual environment. And scenes like this, I'm sure, are familiar to everyone. And we've had to adapt our services as well. So rather than delivering structured education, such as Daphne or Expert in a little room with, a group of individuals around a table, we're now having to do these things online as well. But it is doable, so we can adapt and modernise. We've always had, the purpose of this talk isn't to talk about diabetes therapies, but there's an overwhelming amount of medications and therapies and options and pathways out there. So again, understanding these and having that expert skill set to be able to direct and individualise therapy accordingly. And what we've also seen, even pre-pandemic, but especially accelerated since then, is the diabetes technology. So the various different gadgets and gizmos that we have for glucose monitoring, whether this is flash monitoring, gadgets that can work with apps on the phone or with smartwatches, insulin pumps and closed loop technology. And whilst this might feel that it's very much focused on type 1 diabetes, things are changing and there's more tech available to support people with type 2 diabetes as well. And people like that and are becoming much more familiar and comfortable using this as well. So clearly, diabetes has been a huge, huge, I don't want to say burden, but it's certainly been a big demand on the healthcare system throughout the world, including here in the NHS. And there's clearly a need for an expert skill set across multiple healthcare disciplines in both primary and secondary care services. And there's real opportunity here for us to integrate modern technology and apply the new skills that we've acquired into routine clinical practice. And there's opportunity here to really modernise and improve our services and do some of what we did before and some new things as well, rather than simply reverting back to the old, so we can still meet the best individual care that our patients need. So how can Cardiff University help with this? So we here at Cardiff University and the team who deliver postgraduate diabetes education have a long history of supporting this, and we're probably one of the longest running online postgraduate diabetes programs, certainly in the UK, but internationally as well. And we've had thousands of graduates across the world. And to quote our course director, Professor Colin Diane, our graduates join a growing network of international, what we like to call clinical leaders and innovators in diabetes care. And graduates from our courses have gone on to become lead specialist nurses, nurse consultants, practice leads in general practice, leads within their secondary care teams, setting up private clinics or setting up public health clinics in Africa, in India, all sorts of things. So people have really used the knowledge gained and applied them to their clinical practice, and to help both with delivery of care to improve diabetes service for their patients, and also for professional career enhancement. We offer quite a variety of programs here. There's majority of individuals who sign up to our courses undertake the 2-year postgraduate diploma in diabetes, and many do go on to do a 3rd year to complete the master's dissertation as well. All of our modules are available as standalone modules as well. So if you're only, if somebody only wishes to undertake further studies in a subspecialist area, they can do just an individual module rather than an entire course. So that option is available as well. And we do offer short courses and CPD events, all related to diabetes with very much a clinical flavour as well, so that it's directly applicable to the workplace. and it's suitable for all medical and allied healthcare professionals working in the diabetes field. So we've had doctors from primary and secondary care, community nurses, practice nurses, diabetes specialist nurses, individuals working both in adult and paediatric services, podiatry, pharmacists, dietitians, paramedics, really anyone who encounters and works with people with diabetes. Because the courses that we offer are distance learning, they're delivered entirely online, and therefore they offer flexibility as well. So people can learn at their own pace and can fit this into times that suit both their personal and professional commitments as well. So it allows that flexibility while still gaining, master's level education. And our academic team is all staffed by practicing leading clinical diabetologists who have expertise in training and education. And because we are all practicing clinical diabetologists, we're doing what we teach as well, and are therefore aware of the needs of the current service. So just to give you an overview of the postgraduate diplomas, this is what the majority undertake, and components of this, as I said, are available individually as well. So the diploma is delivered as 6 modules over a 2-year period. The first 3 modules are what we like to call the core modules, so everybody undertakes these. And broadly speaking, these 3 modules are principles of diabetes. And in this module, what we cover are diagnosis, the caveats with diagnosis, the pathophysiology, the different types of diabetes. So very much that early, identification period, understanding the underlying pathology, and then also looking at early management. So a focus on effective lifestyle management, on exercise therapy, on nutrition, and prevention strategies as well, diabetes remission strategies. So it's very much looking at understanding what diabetes actually is, effective diagnosis and early management. The second core module is diabetes management. And that's very much a therapeutics module. So focusing on diabetes therapies ranging from all of our oral and injectable non-insulin therapies, and moving on to insulin therapies in detail as well. And then the last core module is diabetes complications. So talking about the different micro and macrovascular complications, effective screening strategies, risk stratification, and management. So really very much quite a comprehensive overview of diabetes, and this follows the International Diabetes Federation curriculum. So these are our core modules that everyone doing the diploma would undertake. And then in the second year, people can choose 3 of the following options, and we're constantly adapting and adding to this based on needs and as services and guidelines evolve as well. And so this is where people can really tailor their postgraduate diploma to their personal individual learning needs, areas of interest and areas that are most relevant to their areas of clinical practice. And these include things like cardiovascular disease, management of diabetes in pregnancy, insulin management, so going all the way from the different types of insulin, the different regimens, the practicalities of initiation and titration. So an entire module dedicated just to insulin management. We also have a module dedicated to pump therapy, to management of diabetic foot disease, pediatric diabetes, and we're looking at expanding the pediatric options as well. And also at the other end of the age spectrum, diabetes care in the elderly, because we do have an aging population with increasing prevalence rates of diabetes in the elderly, and they have different care needs as well. So looking at that other end of the life spectrum and looking at end-of-life care as well. Then there's also modules dedicated specifically to inpatient management of diabetes, and those admission admission policies and procedures and guidelines there. And then also a module dedicated more at effective self-management and diabetes issues more relevant to primary care, as well as these. So people can pick and choose and then tailor this according to their personal learning needs. All of our diplomas, all of the modules for the diploma are 10-week modules, very much adult learning, because we know this is postgraduate education, so people can learn at their own pace using methods that suit them best. Throughout the module, there are topics that change on a weekly basis, relevant to the overall theme of that module. and you get given topic-specific reading lists as well based on current evidence and guidelines to help. So throughout the module, not only are you acquiring skills to find evidence and guidelines yourself, but we also direct you to the most cutting-edge, current and relevant information as well. Everyone is allocated to groups, to small groups, 8 to 10 individuals, sometimes smaller, sometimes slightly bigger, depending on demand. And you have tutors allocated as well, who are all consultant diabetologists who can facilitate discussions. And then we also include clinical cases so that the themes for that week can be applied to a clinical context as well. We encourage the use of a reflective log so that you can individually see how the learning that you're acquiring, that you're gaining, can be applied to your clinical practice, and then some formative and summative assessments as well. So we use a variety of teaching and learning methods because there is no one size that fits all. Some people are stronger in MCQ papers, some people are stronger in written work. So we use a variety throughout the 2-year period. And then successful individuals and those who are interested can also then proceed to do a 3rd year to do a master's dissertation in a special interest area and can and complete the MSc. So all of our postgraduate diplomas are what we call level 7, so master's level modules. So to end with, what I would like to do is show you a video just summarising what we've been talking about, and then there's opportunity there for questions. So I will just flip over to the video now. So if you bear with me a minute, here we are. So it's only about 3 minutes.
There's over 350 million people with diabetes worldwide. It's increasing dramatically, both in developed countries and developing countries. But it's a problem that we all share. And for that reason, in every health system across the world, diabetes is becoming a major priority. The diploma course that we offer in diabetes began around 2007. And it's one of the longest established courses, online courses, in diabetes in the UK and in fact globally. So we've trained over 1,000 students now in this course. Almost all our students tell us that at the end of the course they feel more confident in their clinical practice and they're enjoying their clinical practice more.
It is a fantastic opportunity to learn diabetes in a platform from multiple people from different parts of the continent.
Traditional teaching means that we have to go to the university to have face-to-face training. However, the online program helps you to have the complete flexibility. You can be in a completely different time zone and you can still be working and interacting with your colleagues and with your tutor in a very flexible manner.
So what you get when you sign in from the Middle East or India or Canada or the United States is exactly the same. Even if you're not part of a large institution, you have access to thousands of journals.
You can use it very easily. Just if you know the few first steps, it will give you the instructions so you can deal with the computer very easy.
Cardiff is part of the Rust Group of universities within the UK, which is the leading research active group of universities, including Oxford, Cambridge, London, and so forth. Certainly within medicine, Cardiff University has a major share of online courses within the UK.
We now have the diploma, we have a master degree, and also we have individual courses or a certificate of a program. The methods of teaching are very important as well, because really the strength of the course, not just in the practicality, but in the content as well.
Well, it has definitely broadened my knowledge in the field of diabetes and gave me more confidence in making diagnostic and management decisions.
I wanted to improve more. I wanted to have more approach towards perfect management. So there's no such thing as perfect, but still.
And I said, this is what I have been looking for a very long time.
All of our tutors are specialists in diabetes. Many of whom graduated from our courses, so they know how it runs.
Also, it is taught by people who have already got an interest and considerable amount of experience in diabetes, who teach evidence-based medicine.
So many of us, myself included, are people who are actively conducting research in type 1 and type 2 diabetes.
The incidence of diabetes is rising, as is the incidence of obesity, mainly in type 2 diabetes, but we've also seen an increase in type 1 diabetes. Yeah, since I've been doing the course, a couple of people have asked me, is it worth it? Doing the whole MSc and the postgraduate diploma, and I have to say I'd highly recommend it.
If you take part in this course, you'll enjoy your clinical practice in diabetes very much more than you did before. You'll be proud of what you did.
It was a no-brainer, whether to join or not. I said, no, this road is a road I should be traveling on.
Right, thank you very much. So any questions at all from anybody?
Hi Neera, I'll just post some of the questions that we've had. So anybody who wasn't waiting for the camera to be on then, who can tell by my hair.
I'm sorry, I do apologise. I think I had my camera off as well. I'm so sorry. Nobody shouted out to me.
So if anybody's got any questions, please pop them in now and we'll make sure we ask them to Neera. Right, let's just get these ones up on screen. Do we know if diabetes is hereditary?
So yeah, there is a genetic component to diabetes. Interestingly, we see a greater concordance in identical twins with type 2 diabetes rather than type 1 diabetes. So yes, there is a genetic component. Even people with type 1 diabetes, if you have a first degree relative, so a mother, father or sibling with type 1 diabetes, there's a much greater risk. So yes, compared to the general population, there is a genetic component.
Is there a link with type 2? I know type 2 diabetes is quite different, but are you more predisposed to it if your family have it?
Yes, so there is a greater risk, yeah. So with type 2 diabetes, there is a combination. Obviously, there's a significant lifestyle component to it as well. It is associated with changes in weight and insulin resistance, but it's not all that. And the pathology of type 2 diabetes is incredibly complex. So you have disorders of pancreatic function and insulin resistance, and works with the liver, gut hormones, central systems, and a genetic component. Yes, there's many different processes, which is why we do spend time within the diploma actually looking at the pathology in a bit more detail as well.
You give figures for France. Do we know how many hospital admissions had type 2 diabetes in the UK?
So in the UK, it was approximately 50% as well had not just diabetes, but diabetes or even new presentations with hyperglycemia. So undiagnosed diabetes or new onset diabetes as well. So approximately 50% and about a third of individuals, unfortunately, who died due to COVID-associated complications did have diabetes as well.
Thank you. This is more a comment than a question. Partner is an optician and is concerned about the reduced eye screening due to COVID.
So I think, yes, so this has been, again, one of those challenges to do with social distancing and those things where the numbers, unfortunately, and the need for the deep cleaning that needs to be done after every individual now is very different. The requirements now are very different, and that's obviously hindered numbers. It depends where this question is coming from, because screening practices are different, for example, in Wales and England and outside of the UK as well. But certainly from talking about what's happening in Wales, the screening services have been reinstated, but the numbers, because of the restrictions, are unfortunately not quite at the same capacity. But more satellite units are being used, even high street opticians. There are satellite centres being more and more being made available for this catch up. So yes, so unfortunately there have been some cancellations, but there is that recovery phase happening now.
Am I able to do modules from your postgraduate courses? I think you did say yes, that is a possibility.
Yes, so all of our modules are available as individual standalone modules as well.
And there's a separate question here. You mentioned the ability to learn at our own pace. Are there deadlines to complete modules? Also, can modules be started at any time?
So the start and end dates for the modules are fixed. So within the module, there is flexibility. But yes, because of the way it is designed in terms of, there are group-based and tutor and tutor availability as well. So there are deadlines for the beginning and the end, but there is flexibility within that. Because of that live component of it, it can't be completely done, whereas you say, right, you start your diploma in September and you have to finish it by the following September. We do have start and end dates to the modules, just to be able to allow that live interaction with your peers and tutors as well. And actually the feedback that we get, that's one of the most enriching and valued part as well, is that learning from your peers and colleagues and tutors as well.
And you mentioned, you can take this wherever you are in the world. Is there sort of a focus on UK for content, or is it very generic?
No, it's every. I mean, the guidelines, management of diabetes, the guidelines are very much, it doesn't matter whether you're managing it in the UK or in India or in Nigeria or in Canada, the management is what the management is. It's how you access those facilities and resources that's the challenge in the different places. So we teach based on best practice, and then what emerges in the discussions is how people can then adapt that. And this is where the reflective component comes on, where it's like, fine, so this is recommended best practice based on international consensus guidelines. How do I then adapt that? What is doable in my practice and what isn't, and what's the best alternative? Or is what I'm doing perhaps even better than what recommendations are? So what we do, so the way we teach, it's not UK specific, it's applicable everywhere.
That's brilliant. We've got one more question, so if anybody wants to pose another one now, please pop them in. I feel poor comms around symptoms and importance of diabetes management. How can we improve this?
Excellent question. And these are exactly the kind of discussions we like to have within our groups, because you're absolutely right. There's a lot of information about, complications and if you have diabetes XYZ, but yes, absolutely. And going back a few years, Diabetes UK, which is one of the leading UK charities working with diabetes, launched a big, what they call the 4T campaign, talking about, needing the toilet, feeling tired, feeling thirsty, feeling, becoming thin, so weight loss, highlighting, those symptoms of diabetes. And there was a big campaign in schools, particularly. I think this may have been Wales only, but it might have been national. But I certainly remember my own daughter coming back from school one day with a little blue bag filled with, with 4Ts written on it. And so these sort of promotional events. But a lot of this is done through charitable organisations. But you're absolutely right. The media can do a lot more. Public health campaigns can do a lot more. And I think things are changing. People are becoming a lot more aware. And perhaps over the last year, people have done a lot of reflection on lifestyles, awareness of, good personal health to help, good physical health to help with your mental health as well. People valuing the importance of exercise and more physical activity and healthier eating. So there's a lot more happening there, but it's tying those two together. You're absolutely right. More can be done about it, and hypothesize and generating these ideas and what you can do locally and how we can apply that is all part of what we like to do in the course as well.
You mentioned the 4Ts there. My children in primary school, and we've had a couple of letters and emails from the school this week about the 4Ts. Is there a bit of a push for more paediatric sort of diabetes awareness?
There is indeed, because sadly one of the leading causes of death can be due to type 1 diabetes, undiagnosed type 1 diabetes complications. So there is a big push on increasing that awareness, because it's something that we probably think of as healthcare professionals fairly commonly in adults. It's quite easy to test, but you don't necessarily see that in children as common. It's not as frequent in the pediatric population. So it's even more important to have that awareness. And we have seen an increase in diagnosis and presentations as well. So the rates are increasing, hence the need for that awareness to be there as well to avoid delays in diagnosis.
Is there a reason behind the increase? Or lifestyle?
So yes, lots of different reasons. So type 1 diabetes isn't really a lifestyle related illness at all. It's completely different. It's an immune mediated condition, and so with this, there are numerous environmental factors. So we do see there are certain pockets around the world where, for example, there may be more association with radiation, those kind of things. Viral illnesses are thought to be, so whenever there are, and in fact, historically, it's quite interesting when you do look at pandemics, viral pandemics, there has been an association with increased diabetes presentations related to that. And I think I mentioned that COVID has been associated with a change in pathology triggering new onset diabetes. But we are seeing that, and there are clearly factors within modern lifestyles, because even when we look at rural countries. I take India as an example just because I happen to be quite familiar with what's happening over there. But you see that in urban areas where people are leading more of a Western lifestyle, you're seeing increasing prevalence rates of these forms of diabetes as well. In urban areas compared to rural areas. So there are clearly environmental factors that trigger these immune responses, though there isn't a clear recognised causing agent just yet.
Thank you. I've got another question here. I read somewhere that diabetes is due to a disorder in the brain. How true is this?
Not one that I'm familiar with, but that I will never claim to know everything. So it's not something that I'm aware of. There are numerous theories and good evidence for changes in hormone regulation and central hormone release. So hormones that control appetite and satiety, for example, and those centrally mediated, so nervous system mediated hormones can be associated with lifestyle changes. So, for example, if you have if somebody's overweight, and that disrupts the balance between these hormones, and therefore you have an increase in appetite, and you can have a reduction in your satiety, leading to overeating and weight gain and those things. So there are mechanisms like that that are associated with it, hormonal things. So whether that's perhaps what you've what was being alluded to in the reading that you've done is what I would postulate there. But whether there's anything else centrally that I'm not aware of, I can't say.
Fab. Thank you so much, Neera. I think we've answered all the questions. You've had quite a few actually, so it's been quite nice and interactive. Where can people find more information on the courses if they want to find?
So on the Cardiff University website, if you simply go to, even in Google, if you just put Cardiff University Diabetes Diploma, it'll take you straight through to our pages. Or if people have a pen and paper handy, I can put it in the chat box, but Diabetes Postgrad at cardiff.ac.uk. So that's our email inbox. So any questions that you have, if you want to ask me, or if you want to know any of the processes for how to apply or anything like that, if you just drop us an email, I'll put it in the chat now actually. Just bear with me a minute.
And also, if anybody's got any questions, they've got our contact details and you can't find Neera and the team, drop us a line and we'll make sure that we pass those on to the diabetes team to answer and to refer back to you. Fantastic.
That's absolutely fine, yeah, and I've put our email address in the chat box, so you're very welcome to get in touch with us anytime.
Fantastic. Thank you so much for your time this afternoon, Neera. It's been really informative and really practical and really nice and interactive as well. And thank you for everyone who attended. And we will be popping this one up on YouTube if you want to refer back to it at any time. Fantastic.
Okay.
Thanks so much.
Thank you very much. Thank you.
Take care all.
Okay.